But the fact is that both disorders fit what Minkoff in his sixth practice principle calls the disease recovery model, okay? Both major mental illness and addictive disorder fit this disease recovery model. And interestingly, the concept of recovery has been there for a long, long time in the substance abuse treatment world. It's only a more recent kind of phenomenon or understanding or perspective or paradigm in the mental health treatment world, but I think a valuable one. And I think the progression of co-occurring disorder treatment has been part of what's pushed the understanding that yes, somebody can and people do recover from mental illnesses, as they also do with substance use disorders. And so what are the features of a disease recovery model? Well, the first thing to consider is that somebody comes to the attention of the treatment system because they're in some sort of crisis, okay? And that crisis can be one, the other, or both. But regardless of what it is, the first phase is to stabilize that crisis. So if the person's in a substance use crisis, that means they're using uncontrollably, they're experiencing a lot of severe negative symptoms of their uncontrolled use. They may be putting themselves at very high risk, physical health-wise, life circumstance-wise. They may, in fact, be unable to stop using without outside intervention. And so somebody who's that far advanced in an active addiction, they may need medically supervised or subacute detox as that stabilization intervention. And they may need residential treatment, a very structured and supported environment for a period of time in order to get some separation from that active, addictive kind of impulse. And similarly, on the mental health side, if somebody's in crisis, typically the symptoms of their mental illness have gotten to the point where they're very severe and they need significant structure support intervention in order to stabilize from that crisis place where they may be at risk of harm to themselves or somebody else, or may be unable to care for themselves in those significant domains of life without outside intervention. So similarly to going to detox or a residential substance abuse treatment center, folks who are in psychiatric crisis typically get admitted for a time in a psychiatric hospital until those symptoms can be brought into sufficient stabilization to where the rest of the treatment or the recovery pathway can be achievable. So what happens next after stabilization? Well, when folks are stabilized in one or the other of those disorder set of symptoms, then rehabilitation is the next order of business. And good rehabilitation explores with somebody what are the services and supports, what are the interventions and the right mix of interventions that can help that person to maintain their stability. The stability on the substance abuse side is ideally staying clean and sober. What does a person need to learn, use, skill-wise, support-wise, in order to maintain the stability with regard to their substance use disorder? And similarly, on the mental health side, what does somebody need? What tools in their recovery toolbox are necessary to help them maintain stability with regard to their mental or emotional illness? And so that can be different for different folks and different disorders. On the substance abuse side, maybe it does involve, some substance abuse counseling, attending, 12-step fellowship groups, getting with a sponsor, working the 12 steps, maybe taking a medication like antabuse to help strengthen that person's resolve and their early recovery. On the mental health side, it may include taking, medication, psychotropic medication, involvement in counseling for mental health issues and whatnot, seeing a doctor, working with a case manager, working with a recovery coach or peer support specialist. Those are all the interventions, the right combination of which helps somebody to continue their stabilized position and make progress in recovery. as they continue this path of rehabilitation, or I like to call it recovery. So what about denial? Well, denial as a concept has had a bad time of it in old school substance abuse treatment. When I was first trained as an addictions counselor, I was pretty much coached that, denial is the enemy, and I had to take my big therapeutic club and I had to smash through somebody's denial, because unless that denial could be broken down, the person was not going to be able to receive help. Well, I no longer think that that's valid. I don't know that I ever did, but I certainly don't today. And denial is a defense mechanism. I think it's properly understood as a defense mechanism. And defense mechanisms are there to defend people, to defend something that's vulnerable, something that can't reckon with the true nature of their condition in this case, so people keep it at a distance. And it's our job as treatment professionals, as practitioners, not to smash through this defense mechanism, but rather to help that person identify and strengthen internally, internal strengths, right? Internal coping skills and strengths, and to also strengthen their supporting environment, the support network, people around them, services, structure, supports, so that that defense mechanism is no longer necessary. And it will recede as those other things are strengthened as a more appropriate, recovery-oriented way to help somebody work through their denial and come to the true understanding of the nature of their condition and be able to accept the help that is available and that is effective in helping with their dual recovery. Powerlessness is another part of this disease recovery model. And this is a word that is also a loaded one that not everybody is comfortable with, particularly folks who have co-occurring post-traumatic stress disorder and addictive disorder. And if the cause of their post-traumatic stress happened to be interpersonal violence, physical or sexual in nature, then that's a very disempowering experience for most folks, and one in which they do feel powerless. And so without sufficient explanation, they come across this concept that they're powerless over their disease, and a lot of survivors of trauma don't care for that notion. But I think the way to explain it and the way for folks to understand it is simply that neither major mental illness nor addictive disorders, people can't will themselves to overcome those things under their own power. So if they could, they wouldn't be referred to us, right? So the way I think of it is, okay, my person can't sit in their room and by the sheer strength of their own will, overcome their addictive urges, overcome the symptoms of their mental or emotional disorder. And that's not a negative judgmental thing. It's a statement of reality. And so in that respect, a power greater than that person's self, right, need not be a supernatural deity. It can be defined, and for many people, they find it useful to define it as something other than just themselves. A power greater than myself could be anything that comes from outside of me that helps me in my dual recovery. And so the help that needs to be asked for from a higher power, to use the language of 12-step recovery, again, it could be defined by any individual as that which is greater than just them sitting alone in their room. So that could be the medication that helps me stabilize my depressive symptoms. That could be the support group that I go to that encourages me and gives me hope because I see other people recovering from the same addiction that I have. It could be the therapist who's teaching me, how to get a better handle on managing my emotions, or teaching me good skills that I can use in what otherwise would be awkward social situations that might trigger me to want to use, or refusal skills when the dope man comes knocking at my door. It could be that power greater than myself could be my doctor, my case manager, my recovery coach, my supports coordinator, any other person in my support network, natural support or hired support, that contributes something to me that is useful for me in overcoming, in this case, my dual disorder. So that's oftentimes a more palatable and useful way for people to understand the whole issue of powerlessness and the need for a power greater than the self in order to make progress with their dual recovery. I love some of the slogans that have come out of Alcoholics Anonymous. I think they're applicable more broadly or more widely than just AA. And one of those is certainly one day at a time, right? One step at a time. What are those? Well, as somebody who's been trained in cognitive behavioral therapy, to me, those are nice, little, easy to remember cognitive reframes, right? Whenever somebody's feeling overwhelmed at the sheer immensity of all the challenges of life, all the problems, all the, it's easy for somebody, especially if they're prone to depression and haven't had the opportunity and practice to develop different cognitive behavioral coping skills. It's easy for somebody to feel easily overwhelmed, and then in that kind of hopeless feeling, overwhelmed state, to do the thing to feel better that they've always done, namely use or engage in some kind of other maladaptive coping behavior. But these slogans like one day at a time or one step at a time are nice cognitive reframes. It's like, it's not this huge overwhelming mass of problems. It can just be the next best thing, the next right thing, the next thing to do to help yourself move in a positive direction. And focus can be, narrowed from this big overwhelming, cloud of problems to just that one thing, just that one thing that needs to be dealt with. And then there'll be another thing, but it's just one thing. And then there'll be another thing, but it'll be just one thing, right? So kind of a easy to remember, way to help keep from becoming overwhelmed. That and other slogans are examples of that. Recovery is never done, but gradual progress can be made. Some folks start out thinking, gosh, that's a bummer. I'm never going to graduate from my dual recovery. Well, what's your definition of recovery, right? If recovery is having a life worth living, why would you want to graduate, right? Why wouldn't you want to continue to strive and hope for and believe in the opportunity to have life improve and improve and improve and improve in different domains, that historically have not been in very good shape. So a lot of folks who come in kind of saying, oh, that's a bummer that I never graduate, end up reframing that and thinking, oh, that's a great thing that I never graduate, because ongoing progress and ongoing, quality, raising the quality of my life in this, that, or the other domain is part of what, dual recovery can become for that individual. So that's another part of the disease recovery model.